The treatment phase can be very difficult for the patient as well as the carer. So a lot of the carers find they feel so helpless when the patient is feeling really unwell and just having to go through the motions again and again through the treatment, and the carer can just feel so helpless through that phase, which some people do really struggle with that. And again, we do have supports within the treatment phase that carers can access as well as the patient.
It's often good to ask that loved one what actually would be supportive to them. Would it be accompanying them to appointments? Would it be asking the medical team questions? Would it be driving them to the appointment? Those are the sort of things it's really good to have open and clear communication and not always guess what someone else wants.
You know, in terms of how you can help your loved one, a relative friend, then it's about trying to give them support, being an extra set of ears, taking notes, being an advocate for them, talking about the things that they've probably been discussing with you personally. You know, if they've been saying, oh, I'm really troubled by pain, speak up on their behalf in a consultation. If they've been saying, I don't know what's going on, speak up on their behalf and say, look, no, we're not quite sure what's going on.
Keeping tabs is hard and can seem quite overwhelming at the start. And what we usually say to patients and their families who are there when they've met maybe more than one clinician on the multidisciplinary team is, when they go home, put everything on the table, what they both think, two or three of them think they've heard. There'll be differences, everybody will hear something different. See what the common 5 or 6 dot points are, and if they need clarity, ring back in and we'll clarify it. That again, that it doesn't take over their whole home life, that they don't sit waiting for this long list of things to happen, but they go out and enjoy things, take the dogs for a walk, go out to eat, go to family gatherings, go to the football when it starts, and things like that. So
when patients are going through the treatment for cancer, they may experience the side effects of the actual cancer, but also side effects of the treatment. Many patients and carers also find it very useful to talk to other people who are going through the same treatment.